Salam. Thank you for having me again. How are you doing today on this lovely Thursday morning?
Alhamdulillah. You're looking good. Are you all right? I was very worried when I'd heard that you were not doing too well a little while ago, but you are looking as gorgeous as ever. So I'm sure you are okay. Are you fully recovered?
Um, well, recovered from the what is it? The immediate COVID, but apparently there are long term side effects, which I think I have. I am unusually tired. I'm usually an energizer bunny, so this is quite strange for me. I'm finding I'm needing to rest more. I sleep more than I used to. But you know what? In my stride, Alhamdulillah, I'm okay. I made it fine. So shukr, Alhamdulillah. Um, I was quite worried because I'm not sure if everybody knows, but I'm expecting at the moment. So
And
that was a
it's
big worry.
twins, of course. Alhamdulillah. I'm so excited about it. That was when you and I chatted via WhatsApp, that was a big concern of mine as well. But as a doctor, what were you thinking at the time?
You know, there are no real studies or any kind of information on pregnant women as such. So it's really just going with what happens at the time. Look, I do know a few pregnant women who did have COVID. Some got very severely ill, and others got better quite quickly. Unfortunately for me, I did have quite a bad pneumonia. So I was on oxygen for a few days. Um, so that was a concern because if you're not oxygenating, obviously then the babies are not oxygenating adequately.
Of course. Right.
But shukr alhamdulillah, as soon as I got better, I went to see my gynae and they did what they call an in-depth sort of fetal scan. And shukr, they look fine. So alhamdulillah, I think I was one of the lucky ones. Shukr alhamdulillah, I'm fine. And the babies are fine
Great.
too. So,
Great.
so
When are the babies due?
they say, well, the actual date is August, but apparently twins don't make it to the full date. So we're looking around 28th, 29th July. If I make it that far, I'm so huge at the moment. Okay, I don't know.
Inshallah, don't worry about what you look like. The face is very pretty, alhamdulillah. Fatima, just before we kick off with the interview, I just really want to thank you indeed from the bottom of my heart for being so candid about your own condition, number one, and also when we started a few weeks ago to talk aesthetics, you were very candid about the procedures you yourself have undergone. I know people are very shy, they're very secretive, they're very coy about the fact that they do, they undergo aesthetic treatments. And I'm kind of wondering why. You as a medical doctor run this practice together with your two sisters who are also doctors. And you guys seem to be, I mean, I haven't talked with them, but with you, you're very upfront and very open and honest about what you do, what you've had done to yourself. And there must be a reason for why you are so upfront.
So the thing is that aesthetic medicine has always been a taboo subject. People don't really want to talk about it. People don't want other people to know that they've had procedures done. It's always a secret, like nobody wants anyone else to know. But I decided when I got into the business almost 15 years back that if I can't talk about it myself, if I can't tell people, look, I've done this, then why should they come to me? Why should they put their trust in me if I myself am so shy of talking about it? That's the first reason. The second reason is people need to realize that we don't end up looking like they call you the cat woman or the overfilled syndrome or the over what is it called? It's called an aesthetic syndrome where you're too overfilled and you've got too much Botox and too much fillers and you've had way too many procedures done. So I was actually going to look for a photo of myself from a few years back, but I can't seem to find any. Just to show you that I don't look much different. I really just look the same as I did, I would say 10 years ago. It's really just trying to maintain and not, because I've said this before and I'm going to say it again, the age of human race has increased. So our mean age of surviving has gone from like 59-60 to 72-80. That's the mean. So our age has increased. So with age, remember, our skin ages at the same rate. So you don't want to be a healthy 60-year-old with actual 60-year-old skin. It doesn't sort of go with your, the whole emphasis around the world at the moment is eating healthy, living healthy, exercising. So you've got this optimally functioning body, and then you've got this really aged face, which don't really go together. So it's just to make you age sort of gracefully. And as we know, with age, everything kind of droops. We know this from every part of our body. Your
Gravity.
Exactly. Gravity just kind of pulls everything down. So it's just to, lift it up a little bit.
Make you look fresh. Make you feel good about yourself.
So the biggest complaint we get, the most common one, is that I always look tired. People always say that as you get older, you tend to, so my kids look at me and they want to know why I'm always cross. Or my husband looks at me and asks me why I'm always tired. Or people at work always ask me if I haven't slept enough. So it's just to get you that rejuvenated, sort of youthful look. Honestly,
okay.
That's my motto in life. I'm not trying to change anybody.
Okay, I think the two, one of the big questions we also need to ask is costs. People are often, women want to invest in themselves as they would invest in clothing, a good item of perhaps designer shoes, bags, designer clothing, because those type of investments, you buy a designer bag, it would give you life for 10 or 20 years, whereas, you buy something that's kind of high fashion, you can only use it for one season. So you talk investment here. So you want to invest in yourself because it's going to make you feel good about yourself. I'm sure it's tied in with your self-esteem as well. It has to be.
It is.
But we're looking costs. A lot of women are frightened away by the costs of aesthetics.
So off the bat, aesthetic medicine, you shouldn't be looking for the cheapest thing around, just off the bat. Okay, so that's not something that you should be looking for. But having said that, aesthetic medicine is not unaffordable or something that's not approachable just for the general public. So I'm going to give you an example, and I'm not sure if I'm allowed to do this or not, but I'm going to do it anyway. So if we're looking at, say, just a person who's got maybe acne or acne scarring or a bad skin, or someone who's got so we're going to talk acne and acne scarring. What we do at our practice is we always break it up into so we have a treatment plan. Okay, there's the quick route, and then there's the budget route. You get the same result. It's just some people can afford to do it quicker and others take a longer period of time. But your result at the end would be the same. And generally, my approach is always, I would always give you the treatment plan, and then I would say to you, what is your budget? How much can you afford to put out per month? And then we kind of try. If we can't, then I will unfortunately have to say, look, I can't do it in that budget, but mostly like about 600, 650 Rand a month. We can work that in, a budget plan. And that's just for acne and acne scarring, right? So like that for all other, pigmentation is a bit more expensive, a bit more intensive. So like 600 wouldn't kind of cover that monthly cost, but your results women are willing to save up if you can guarantee them a result. Okay, and then let's talk, for example, let's talk Botox, so neuromuscular blocking, for example. So if you wait till you're much older, so say for example, I get a 35, 36-year-old girl, she would need a lot less. Okay, so it'll be a lot cheaper than if I got for the first time a 65-year-old. So she's going to be in the treatment category. So we're not maintaining, we actually now trying to reverse. So that costs you. So if you start earlier and you do, few things over months. So I always tell my patients is that I'm not going to do everything in one go unless you really want it done. Because firstly, every procedure has a side effect. Now, if I'm going to do a neuromuscular blocker, a filler, a thread, all in one go, and you have, Allah forbid, you have a side effect, I can't differentiate which one of those three gave you a side effect. So if I do a filler first, and then a neuromuscular blocker, and then a thread, I know what's going on. I can also for myself, know that this is what I did. This is the result I got. You look better. And so we can go on. So from a cost perspective, there's always a way of working it in, budgeting it in. You can always say to your doctor, say, for example, I've got a 50-year-old lady come in. Now, say that's her first time she's come in and she's got these huge marionette lines and she needs them sorted out, and obviously the droopy cheeks and things like that. And she wants to only do filler. Now, filler is not cheap. It's quite expensive. But if you're going to do 6 tubes of filler at once, because remember, you only get a good result if you use the correct amount. So for me saying, okay, I'll just put in like 1 tube of filler for you and you're going to be fine, that's a lie. I'm actually lying to you. I'm lying to myself. So if I give you the correct amount, for example, you need 5 tubes of filler, but you can't afford 5 tubes of filler today. Then we break it up and we say, okay, let's do 1 tube this month, and then next month we'll do the next tube. So instead of getting your overall result on the first day, it will take us a bit of time and we can work into your budget, but you will get there.
Brilliant. What if we spoke fillers? Sorry, carry on, Fatima.
The only thing is that people have got to understand that if you're on a budget, you don't get the result like this. You've got to wait a bit. That's the most important thing, is they've got to understand that it takes a bit more time. But
okay,
it's not inaccessible, or as the media makes it out to be, that it's only for the rich and famous. That's not true.
We spoke a few weeks ago. We spoke Botox and we spoke fillers, and you really explained it beautifully. I know in different communities, there are different procedures that are very much in demand, very especially in the Western world. It's the boob jobs and the buttock enhancers or whatever have you. Why in the world people would do that is beyond me, but be that as it may, different strokes for different folks. Okay. What else is happening in this space as far as aesthetics is concerned? Botox and fillers are I think it's taken our community by storm. A lot of our women and even our young men are going that route, and good on them because they want to feel good about themselves. They also want to know that, I suppose, if you're in the job market, I know COVID has put a lot of things on hold for now, but I've often been told that, a candidate that is really good looking, looks good, feels good about him or herself, makes a great impression at an interview. So, you take all of that into account as well. But now, apart from fillers and Botox, which you've given us a lot of info on a little while ago, what else is new as far as this space is concerned? And what do you kind of see the future looking like as far as aesthetic medicine is concerned?
So, at the moment, there's a lot of regenerative. So I'm not sure if we discussed threads. Threads is a kind of stitch that we use to lift up areas of the face. So people are also under the misconception that we only use threads to enhance. We can also use threads to rectify, like a Bell's palsy, or someone who's had a stroke. So people who've got drooping on the one side and the other side is up. We try and keep them symmetry. So we give them symmetry.
Are threads permanent, or do you need to redo them after 5 or 10 years?
Aesthetic medicine, there's no permanent aesthetic medicine. So remember, it's a non-surgical approach to everything. People like that approach because, say, for example, because of all the trends, in a few want to do another trend, then obviously it's gone and you can, do that. So threads, depending on the type of the thread, the quality of the thread, and what's made in the thread, it can last anything from 9 months to about 3 years. That's the max with regards to threads. But when we say it lasts 3 years, your face is not, say for example, I lifted my cheek. So I'm going to just show you something quickly. This part of my face is driving me berserk. So I want to actually just lift it up a little bit. So as you can see, there's a line here and we just kind of lift it like that, right? So when we say it lasts 3 years, it's not going to fall back down in 3 years' time. Your body will start breaking down the thread in 3 years' time. So your body will then start, breaking it down. But you've already laid elastin and collagen on that pathway. So it will still be there for years and years to come, in terms of that. In terms of trends, the world is moving towards regenerative medicine. So stem cells, stem cell rejuvenation, fat rejuvenation. So instead of using fillers in the face, a lot of people are using their own fat. So you choose you don't need a lot. You need, like, you can take just from your outer thigh or your tummy a little bit, 60 mils. We basically then put it in a machine where it extracts the stem cells and gives us something called nano fat, and then we fill and we rejuvenate your face with your own nano fat. So that's something that's very nice, because people are they liking that more, because filler is almost a foreign body, whereas your
Yes.
own fat is your own. And it also gives you better regeneration. So if you know that people are doing like stem cells injections into knees for arthritis, into joints and things like that, so this is a similar concept where we inject the stem cells into your face. You get almost a 10 times more rejuvenation, youthful appearance than you would if we had to use filler, muscular blocking, and laser together, just from the nano fat. So that's something that's very trending.
Are you involved in that practice? Nano fat.
So we started doing this. So it's been in South Africa, I think, about a year. And we started last year sometime. So just as it came into South Africa, we started doing it as well.
Are you getting good results? And both the threading and the stem cell, what sort of side effects can one expect?
So with the stem cells, what people need to understand, that it's not an immediate result. It takes time. Your body needs to actually take it on. So the downside is that people are wanting an immediate result with the stem cells, and it's not. It takes about 2 to 3 months to actually get to the result you want, because your body needs to now rejuvenate in those areas where we put it. A bit of bruising and a bit of pain. So that's from the stem cell transplant. In terms of threads, there's a range of side effects that you can get. So in terms of threading, what we do is we always overcorrect. So say, for example, I'm lifting your cheek. I would lift it like excessively. So can you see how pulled I look? And that scares patients. So we have to overcorrect, because you lose 30% in the first week of the correction. The other thing is that you can get something called puckering of the skin. So the thread kind of catches threads of your skin. Instead of just taking the muscle, it can do that, depending on how thick and how rigid your muscle is. So you get
is that correctable? So if something like that happens,
it goes away. It goes.
Okay.
It just depends. In some people, it can take 3 days. In other people, it can take 3 weeks. So it really just depends. And that really does not scare people, but they get very anxious. So I always give them my personal cell phone number that they can WhatsApp me whenever they need to be reassured or talk to me. Because I feel that if I talk to them personally instead of my therapist or my staff, they feel more reassured.
Absolutely.
Just know that it is going to go away. You get excessive amounts of bruising. You do. That lasts as long as you bruise. And you do get a bit of pain in your face. I mean, I was putting Voltaren gel on my face for about a week.
Okay.
Pain. But you know what? As opposed to going for a full-on facelift, the downtime, the pain, and the bruising is, I would say, a fraction of that.
Okay. Fatima, I think when we just started the series, I asked you about surgical procedures, and you kind of don't seem very keen on it. And you're going to explain to us why. We're going to compare, non-invasive versus invasive surgery, permanency, results, costs, etc. But all of that right after the ad break. I am talking to Dr. Fatima Bhabha. She's an aesthetic practitioner. She is in practice together with the two sisters who are also medical doctors based in Bedfordview, Johannesburg, and they have a surgery in Rosebank as well. So we'll be talking more about something that's taken the world by storm, including our own community. Lots and lots of young people and even older people are now indulging in aesthetics. But first, let's go for an ad break.
This is the Mid-Morning Talk with Julie Alli.
Kiki's, the taste with a kick. Our revamped exclusive restaurant and takeaway now opened. Kiki's strives to serve you and your family with a wide variety of delicious meals. Enjoy our famous chicken, shish, burgers, pasta, pizza, and many more weekly in-store specials. We offer Friday buffet and Brightfit with a difference. We cater for corporate functions, velimas, and events. Perja facilities provided. Our exciting competition gourmet menu and new menu to be released at our launch. Visit Kiki's at 235 Matthews Mayue Road, Old Stemford Hill Road, Durban. Call 031 209 0119. Kiki's, the taste with a kick.
They say breakfast is the most important meal of the day, yet many children go to school hungry because of poverty. Penny Appeal's Breakfast Club aim to get a warm, hearty meal to underprivileged children so they can spend the day prospering in their schoolwork. Help feed a needy learner by visiting our website on www.pennyappeal.org.za or call 031 1100 573 to find out how you can donate. Penny Appeal. Small change, big difference.
Freedom Stationery supply Marlin and Marlin Kids pens to me and my school friends. They supply just about everything we need to help us get a better education, from books to files to rulers. In fact, any any accessory we need. Freedom Stationery. Education for the nation. What does accessory mean?
Connect and stay ahead with Salam Media. This is Salam Media coming to you live from South Africa.
Still to come on the show, we'll be talking with Jason Down. He is a recovering drug addict, and he's going to talk to us about recovery in the application space. Still keeping with technology, we'll speak with Amara Hussein about the new terms and conditions as far as WhatsApp is concerned. But still on the show, the gorgeous Dr. Fatima Bhabha talking to us about aesthetic medicine. Fatima, back to you. Welcome back.
Jazakallah khair for having me. So you are asking, why is the world moving away from, or what's the difference between invasive and non-invasive aesthetic medicine? So if we just look at that, when talking invasive medicine, so let's just say a facelift, for example, because I'm not going into the body. That's like, I mean, I don't even do, bum lifts and those kind of things. So
Any reason for that? Any reason why you don't go into that space?
You can get a non-surgical buttock lift, as they call it, but I just find there's a lot of side effects. There's a lot of complications involved. It's not just you learn the procedure, you do it. It's very tricky. You need to actually be trained specifically in that field, and it's not a field I'd like to delve into. So I've kind of just avoided it altogether.
Okay, Fatima, before you go into surgical invasive versus non-invasive, which you obviously have chosen to be in, all three you sisters are trained medical doctors. You've decided to go into this space. But does that mean that you could never go into the surgical area? Would you have to train to start doing invasive aesthetic procedures?
So we're not surgeons. So
right.
That means we can't do invasive surgical procedures. I mean, if I wanted to do that, I've got to go back and study to become a surgeon, which, I mean, that's not for me. Having said that, though, my second eldest sister has extensively studied liposuction. So we do offer liposuction, which is something that can be done by your GP, but that's a whole topic for a different day. But like invasive is surgical. So, we haven't gone that route. But now
And is it, when you hear about people going under the knife for aesthetic reasons, do they have to consult with a I know that these days they call them cosmetic surgeons, but what's the other terminology for them? Plastic surgeons.
So they would consult a plastic surgeon and they would see a plastic surgeon. Obviously, I mean, that's South Africa. You see a plastic surgeon.
But all plastic surgeons or most plastic surgeons are not necessarily trained to do the type of work, I should imagine, aesthetic work. Or does it go without saying that they do?
It doesn't go without saying. So people assume that if you're a plastic surgeon, you're trained in aesthetics. They do learn it. It's part of their training, but they don't necessarily what's the word? Specialize in aesthetic medicine. They specialize in plastics, so cutting is generally their field of expertise, ideally. But now, having said that, a lot of plastic surgeons do aesthetic medicine. Most of them, if not all of them, do aesthetic medicine. So it really just depends on the expertise, both sides. I mean, like I mentioned the other day, your aesthetic practitioner needs to be really qualified before you choose to go to them. So that's the terminology why. So in South Africa, 90% of plastic surgeons do aesthetic medicine. They do. I think it's part of their training, and they then go on to learn more and more, because I think the non-invasive and the invasive kind of go together if you want that, overall polished look. So when we come to, let's just talk an invasive procedure. So for example, you want to do a rhinoplasty. So an invasive rhinoplasty is where you go to surgery. So you have to go to theater. You need to go under general anesthesia. So you have all the side effects of the general anesthesia. You also have all the side effects of the cutting. So for example, if they cut, you can get sepsis, you can get abscess, you can get infection, all of those side effects. So people have kind of moved away from that, where you can get a non-surgical liquid rhinoplasty, where we use threads or we use filler. But the downside of the non-surgical is that it's not permanent, whereas surgical is permanent. It's going to last forever. So that's two comparisons of the same treatment, for example.
And there's a huge cost difference, I should imagine.
Huge cost.
And how often would the person have to then redo the non-invasive one through you? I mean, would it have to be done every 3 years, every 5 years?
So it's actually every 2 years. It lasts longer because we use a more robust product. Depending on how tweaked you want your nose to look, you come in and you do the treatment. When we use threads, it lasts much longer, so almost 5 to 6 years, and then we just use a bit of filler on the top to tweak it. So that's a much longer treatment time. Having said that, though, a lot of people do the non-surgical rhinoplasty first to see how they're going to look. Because remember, once they've done you can't go back, to see how they're going to look. And then a lot of them, after about 4 or 5 years, do go and do the permanent one. But they know how they're going to look. So then they can make a good judgment, I would say, based on that. The only thing about invasive is you've got to go to theater, so you have all of those risks, and you've got to have cutting, so you have all of those risks. And in terms of cost, most medical aids don't pay for plastic surgery, like they don't pay for aesthetic medicine. So cost-wise, it's actually a big difference in the cost. Whereas having it done surgically versus non-surgically, it's just the one could possibly break the bank, whereas the other one doesn't, basically.
But I guess the thinking is that if they do a surgical procedure, the thinking is that it is possibly going to keep them, not necessarily for life, but for at least 10 years or longer.
So having said that, though, it depends on the procedure. So when we talk about a facelift, for example, a person will go for a facelift, but that's just moving the skin back. So you still need to put filler. You'll still need to do a bit of Botox, because the facelift doesn't smooth out the muscles and doesn't fill out the areas. It literally they just move your muscles back and take out the loose skin and tie it up. So it is specifically treatment based. So will the facelift be better in the long term? maybe yes, in terms of skin, but in terms of fullness, in terms of volume, no, because you still have to do other procedures on top of it. So that's a different one. In terms of a rhinoplasty, personally, if you have a small tweak, yes, we can non-aesthetically do it for you. If you have something bigger, like a big problem, I always suggest to the patients to go the surgical route, because you get a permanent result and it's cheaper for you in the long term. So I always say, like, look at the cost benefit ratio, look at the procedure you're doing, see how much it's going to cost you 5, 10, 15 years. Will the non-surgical be more cost effective in terms of what you're getting, or will the surgical be more effective? And then make your decision. It's not about just, a quick fix. Whereas non-surgical, yes, we do it on the day. It's done. Surgical, you need to plan. You obviously need to go to theater. It's more time consuming. But from a cost benefit ratio, you need to think about it. So if I had a patient who was going for a facelift, I generally say no. Do the non-surgical procedures, because we will lift, we will tighten, we will do all of that. Whereas when you go for a facelift, they generally just, tighten your skin, and then you still need to do all the other non-invasive procedures. So from a cost-effective way, it doesn't really work that well. When we come to, what's the other one that's very common? Okay, lips can only be done non-invasively. You can't really go. You can do a chin lift.
I want to talk, all right, chin lift is it popular? Why would people do it? It's the first time I've heard about a chin lift, let me tell you.
A chin enhancement, very,
My
very
word.
popular.
Okay, first time I hear of it.
So the thing is, I'm not a big fan, okay? I'll tell you why. Chin filler makes everybody look the same, because what they do is that you turn to the side and you kind of measure nose to lips to chin, like that. And the ratio is that this line needs to match your chin. So I'm a bit behind. And they fill you till you touch that line. So ideally, everyone will end up looking like Huda Beauty or Kim Kardashian, because they all have that ratio. If you notice, it's that Jasmine from Aladdin ratio. Big cheeks, pointy chin, small forehead. Yes, people like it, and some people want us to do it for them, and we do. I will. But personally, if you come to me, if you need a slight enhancement, yes, but not to make you look, chinny, where your chin is the biggest feature on your face. But it's moved to that time in our lives where, I'm not sure if you've seen this, but everybody looks the same. Everyone puts their makeup on the same. People put on their makeup the same. They contour the same. Their chins, their lips, their eyebrows, everybody looks exactly the same. So there's no uniqueness left in the world.
Does that scare you? Does that scare you?
It scares me so much.
What would you then advise? Because everybody wants to look good, but they're ending up looking like clones. They're all looking exactly the same.
I always say.
What can you suggest?
Let's enhance what you have. Let's not make you look like someone else. Let's just enhance your features. So say, for example, your eyes are the most beautiful feature on your face. Let us enhance that. Obviously everyone wants a good skin. That's like taken for granted. But in terms of filling, you don't need to have an overfilled cheek or an overfilled lip or this huge chin. It changes you totally. It makes you look, totally different, and I'm not for that, because we're getting into this world where we all like robots. We look the same, we dress the same, we walk the same. We're starting to talk the same because we're all on social media all the time. So we kind of brainwashed into thinking the same things.
It's really keeping up with the Joneses, or the Kardashians for that matter. Fatima, let me ask you this question then. As people, depending on if you've had weight problems or as you grow older, a lot of women are very conscious of a double chin. Let's talk about double chin, then let's talk about the turtleneck, because I think if anything gives you away, your neck, your hands, your neck, and then also crepey eyes. What can you do? Because your eyes start, the skin becomes very crepey.
So it loses elasticity. It becomes thin. So does your neck and so does your hands. So there's beautiful treatments we can do. where we take, it's a superficial filler. We mix it with a little bit of neuromuscular blocking, and we inject it superficially around the eyes. You need 2 or 3 treatments of those. That's a treatment plan. So you need 3, 2 months apart, and it actually helps. It rebuilds your skin. It makes it thicker. So that's for the eyes. So that's in terms of treatment. We can also do, there's 2 types of, there's actually many types of lasers, but the 2 that I have is, one is called a neogen plasma treatment, where we do a non-surgical blepharoplasty, where we tighten and the whole skin, and it also stimulates elastin and collagen. In terms of double chin is very easy and it's a very fun treatment to do. I enjoy it because we get a result sort of in a week. The double chin's gone. It's where you get these fat dissolving injections. They're called lipolytic injections. We really just inject that into the double chin. Depending on the size of your double chin, we'll inject more or less. But it's such a nice treatment because people come in and they're like, oh, I look so, like you just see my double chin, and then we inject it and in a week it's gone. Wow. But also you have to understand why you have a double chin. Do you have a double chin because it's fat, or do you have a double chin because it's a turtleneck, like you've explained? So fat dissolving injections in a turtleneck are not going to take it away. But fat dissolving injections in a double chin with a fat will take it away. So
is it permanent? Is it permanent, or how often do you need to have it done?
So remember, non-surgical procedures are never permanent. You need to do maintenance. So once you get to your desired treatment, you've got to do a maintenance plan. So I always say, like, once every 2 months is nice to come in, unless you're really eating burgers and chips every single day, like, who knows? Then you've got to do it more often, depending on your diet plan. And then also we teach you some good neck exercises that you can do at home just to keep it away. So that's the double chin part. In terms of the turtleneck, there's a lot of things we can do. We combine laser with threads, with injectables. So you get the turtleneck, the same reason you get the crepiness around your eyes. You're losing elastin and collagen in your skin, not your muscle, in your skin. So we've got to find ways of stimulating the elastin and collagen in your skin. So micro needling with hyaluronic acid serums work nicely. If it's a very turtly neck, we actually lift it up with threads, and then we do, so threads lifts the skin, and then we have to treat the actual skin itself. So we would do a laser, we do filler injections, but superficial filler. So it's not the plumping filler like I explained last time. It's the hydrating filler. So we hydrate the neck fully. What works beautifully for this is the Nano Fat Transfer. It's literally one treatment. You get full elastin collagen stimulation, eyes, neck, hands. You can do it in one treatment and you get a beautiful result. Hands, same thing. You're losing volume because our hands look young and good because we got volume. As you get older, you lose that elasticity. So I'm not sure if anybody who's older, when you pinch your skin, it goes up and it takes like 2 or 3 seconds to go down. When you were younger, it would just, flop back.
Bounce back.
Exactly. Yeah. So that's the loss of elasticity.
Right.
So before, the only treatment option we had 5 years ago was filler. That was literally the only treatment option we had. Now we have so many. We do micro needling. We can do superficial fillers just to get hydration back into the skin. We can do the lasers combined with the superficial fillers. Everything that you need. So the most important, if anybody takes anything away from this whole discussion we had today, crepey eyes, crepey neck, and crepey hands is a commitment. And that's how you get rid of it. It's a commitment. It's not a once-off treatment. It's not something that you've got to say, okay, so like I need to, dress up or do my hair once every month, I've got to go and do my neck, eyes, and hands treatment sort of every 6 to 8 weeks. So that I'm building, because as we build the elasticity, your body's breaking it down.
You're saying 6 to 8 weeks for how long? For life, or?
Generally, we say till you reach where you want to be, then we put you on maintenance. So maintenance would be like 3 times a year. Okay, because remember, as we building elastin and collagen, you're still aging and your hormones are still working. So as we build, it's breaking down. As we build, it's breaking down. So it's a symbiotic relationship that we need to reach the plateau. and then we take it from there.
Okay,
basically.
look, it just sounds absolutely amazing where aesthetic medicine is going. You must be very excited, you and your sisters. And I should imagine you guys are on this ongoing journey of learning, because you need to bring all of this back to your clients, your patients, because that's what they're going to expect and demand as well. We're going to go for an ad break, and when we come back, I want to talk about what is it that you offer. You'll respond to my first question about where aesthetic medicine is going to, but also in terms of people who lose a lot of weight, they've got all this excess skin, and apart from going the surgical route, is there hope for them? But all of that and more in the next 15 minutes. Let's take an ad break first.
On the radio when I'm done, they get started. It's okay. It's okay. It's fine.
Shazi. Welcome back. It is 11:49. We are talking to the gorgeous Dr. Fatima Bhabha. She, together with her two sisters, who are also medical doctors, have opened up their own aesthetic practice. They run the one from Bedford View in Johannesburg, and the other practice is in Rosebank. All three medical doctors and doing amazing work in this space. They have been doing this type of work for the past 15 years. And if you've ever entertain the notion that you'd like to have a bit of work done, that you just want to feel good about yourself, that you have a few sagging lines or wrinkles that you want to get rid of, then these are the girls. These are your go-to girls. Fatima Bhabha, Assalamu alaikum, welcome back.
Walaikum salam.
Okay, so we have about 10 minutes left, and I've also had someone call in to ask. I'm going to not interrupt you right after this next question. You have a lot to respond to. Someone's asking that there's a treatment, she's not sure what it's called, but a lot of young girls, after having had babies, go in for this treatment. It's some sort of nip and tuck. What is it all about? Let's share it with our young mommies on the show this morning.
So that's something that we do. It's called a mummy makeover. You have a bit of liposuction. It's literally called a mummy makeover. You have a bit of liposuction done. You take away the love handles, the saggy, tummy, and the thighs and things like that. It's literally just liposuction. Some people.
Is it something you offer as well?
Yeah, so we do a type of a liposuction, which is like I said, my second elder sister's trained for that. But what we don't do is the question you asked earlier on, is people who've lost a lot of weight and they have all this excess skin everywhere. That requires surgery. So that requires you to go in and have what we call a tummy tuck, where they pull the skin down, they cut all the excess skin off, and they stitch it back together. They do the same for your arms. They can do the same for your back, where they actually cut out all the excess skin. So that's for someone who's lost, say, for example, they weighed 100 Ks and they're now down to 70. They would need that. There are other non-invasive treatments for people who've lost 5, 10, 15 kilos. That's sort of where we put in, we use lasers, we use threads, but all depends on the amount of loose skin. You know, if you have a little bit. So let me use pregnancy as an example. So you've had a baby and now your skin went back and it's crepey. It's not that tight skin you used to be. Non-invasive treatments work very well for that kind of skin. So there's a few types of treatments that we can do. There's a carboxytherapy, there's a laser, there's also thread. So depending on the degree of crepiness, obviously we would choose the correct treatment for you. But there is treatment. You don't have to walk around with that saggy skin. So that's the first one. In terms of the mummy makeover, it's very common. A lot of girls go for it. A lot of girls do it kind of concurrently with their C-sections. So when they go in for the cesarean section, they would do this mummy makeover at the same time. Whichever works for you. Personally, I always advise people to wait about 6 months because you've lost all that edema that you get with pregnancy. So you get a better result. But a lot of girls just want to have it done at the same time. It's beautiful because you feel so, you don't feel nice after you've had a baby. You've put on all this weight, your body's sagging in all the wrong places, you have all this excess fat. And you know what, if it's going to make you feel good and be a better mom, then why not? Instead of sitting at home and being depressed about how you look all the time, you can just give all this energy to your newborn baby. If that's what it takes, by all means, I'm like so for it, really. Just have it done.
So, Fatima, would you then suggest the mummy makeover for girls who've now decided they're not having any more babies? Or is it, let's assume the girl's had her first baby, does she have a mummy makeover, knowing that she's planned 3 or 4 more pregnancies thereafter? What are the risks involved? Is it worth it or not?
It really depends on economics. A lot of people, so I've got 2 extremes. I've got some people who can afford to do it after every child, and they do. And then because remember, we don't work inside the body. We're working between the muscle and the skin, literally. We're not going anywhere else. So in terms of side effects, long-term, there aren't really many. It's really just immediate sort of gratification, and you stick to your diet plan, exercise, and you'll be fine. So it really depends. Some people do it after every child. Other people would like to wait till they've had all their kids, which for me makes more sense. I mean, if you're 25 or 26 years old and you're planning on having 3 children, by 30, 31, you probably be done. And then you do, everything at one go. That makes more sense for me. But remember, everybody is different. Everyone's take on life and their own body. And that's the beauty part. You have autonomy to decide what you want to do. And then you can do that. So either way, it really just depends. I mean, I personally couldn't lose weight after my second child. I mean, I lost a lot, but I always had this kind of muffin top at the back. Oh, not muffin. Those are love handles. And they never went away. So I injected them. I did the lipolytic injections. I did, we've got this body slimming treatment at the rooms. I did that. having said that, though, after my second child, the body slimming machines did help a lot because it took a long time for the weight to just kind of start falling off, and that helped me kickstart it. But after 2 years, it just never went away. And so I liposuctioned the little handles. It took about 20, 30 minutes and it was gone. And it was the best thing I ever did because I would always wear something and you would always just see this lump at the back. And, every person knows how they look. So people always are quick to judge. They're like, oh my God, you're so skinny. Why would you do such a thing? And you're so thin. But it's not that. It's like you would look at yourself in the mirror and you would just see this lump, and it subconsciously, people would say, oh, you're so vain, and it's not that. You expend so much of this energy on something that's so irrelevant that you could fix, and then you take all this energy and you can focus it somewhere else 100%. Why not?
I want to come back to that statement you've made, you're so vain. I think one of the other reasons why a lot of people are very secretive about the aesthetic treatments that they undergo is simply for that reason, because they're going to be judged. Oh, you're so vain. How do you respond to that, being in the business?
The thing is that no one should judge another person. I don't think any one of us are in a position to judge anybody else under any circumstances. And I think we do it so often or so readily without even thinking about it that we've got to. I think every human needs to make a conscious effort to not judge another person. So for me, I always tell my patients is, you're not being vain. You're not being like people say, oh, you're just so self-obsessed and you just want to do this and that. There's nothing wrong in self-care and looking after yourself. So like you would do a mani and a pedi, you need to do a bit of, get rid of a few wrinkles.
We've got about 3 minutes left. 15 years ago, when aesthetic medicine was either unheard of or taboo in our community, what made you girls, the Bhabha sisters, decide to enter this field?
So I didn't start. I'm not the one who started this. So this was my big sister and my second elder sister. So she mostly they started mostly with sort of skin peeling. That was what came in those years. So it was like for acne and acne scarring, for dark circles, those kind of things. That was what it started with. So they started with that. Then subsequently, my second eldest sister's daughter was born with a cleft lip and palate. And that's how we got more into, or they got more into this, because you're now looking for scar revision. You're looking for ways that when she gets older, you need to, fix her lip in a way. You've got to lift it up. That's how it started. So that's how they moved from chemical peeling into neuromuscular blockers, fillers, those kind of things. That's actually how it started. And then came, I can't call it a can of worms. I would say a world of opportunity and things that came into their lives.
Absolutely.
And that's how it started. So we still, to this day, do scar revision for my niece, because she's had about 4, 5, maybe 6 ops done already. She hasn't had the full rhinoplasty and things done. That still needs to come. So we still, she's a young little girl. She's 13. She's at school. She doesn't want to be walking around with the scar on her upper lip. So that's how they started. And then I joined them about 11 years back. So that's where it started, basically.
Okay. And there's just no looking back, is there?
Alhamdulillah.
Going forward, for women, girls, even men watching us this morning, what do you want to say in closing as far as aesthetic medicine is concerned?
I think self-care is very important. Being the best version of yourself for yourself is also very important. In the society that we live in, we need to feel good. We need to be, I don't know, you need to feel good about yourself in order. So the bottom line is you can't give from an empty cup. So
Absolutely.
You need to fill yourself up in every way, emotionally, physically. For women, people always tell us that we sort of fixate on our looks, men now as well, but that's what makes us feel good. We're not, ideally we're not really the breadwinner. We kind of stay home and wait for our husbands to come home, and we want to look good. And when we look good, we be better moms, better wives, just better people. And there's nothing wrong with that. So why not?
Fatima Bhabha, Jazakallah so much for being on the show with us. You've really and truly shared so much of information, valuable information at that. And I know there are many women and men out there watching and listening to us this morning, probably debating, have had this ongoing debate with themselves about should I, shouldn't I, should I, shouldn't I, should I do a bit of Botox, shouldn't I, you know. It's been an ongoing debate, and hopefully by way of these programs, we're able to guide them in the right direction. Go well, take care of yourself and the babies, and hope to see you soon. Assalamu alaikum.
Walaikum salam.
Exactly 12 o'clock. That was Dr. Fatima Bhabha talking aesthetic medicine. Next on the show is another gorgeous young lady. Her name is Amara Hussein. She's going to be talking to us about WhatsApp. But I think before we do go there, we have a couple of ads. Am I correct? I'm looking at Milazi Boy, and he has agreed that we have to pay the rent. So let's do that, and we'll be back in a minute or two.